I am so excited that I was part of the AAHA Oncology Guidelines. So it's been 10 years since they've been updated, and why I think they're going to be so helpful is, one, there's a lot of new things in oncology, and these are things that you may be referring to an oncologist for or using in your practice, but it really is just a step-by-step guideline on managing cases. So, what cancers you may see in practice, and we go through that for dogs and cats. We talk about biologic behavior. We talk about when to treat, what staging tests to do, what you can skip. It talks about the different therapeutics that are available, but there's also just an emphasis on teleconsulting and compassion and supportive care. So those medications that can make our pets feel better, whether we're managing GI side effects or pain or just quality of life. So I really think it's just going to provide structure and confidence for GPs when they're either working up cases or treating cancer cases in practice. So I think some of the takeaways that I think about with the oncology guidelines is, one is cancer is treatable and there's a range of options. It's just working with our pet owners and seeing what's going to be good for them. I think staging can be GP friendly. There are so many diagnostics that you can do if you are going to refer a case, and that can be blood work, CBC, chem, urine, aspirates, biopsies, lymph node aspirates, thoracic radiographs. I do recommend that we get them reviewed by a radiologist, and an ultrasound. The other thing that the guidelines are going to help is you don't need to do every diagnostic for every cancer, so we can really prioritize what to do. I was really excited that something that I've been saying for years when I think about working up a case is the 3 Ps. So what is prognostic? Those are going to be the tests that we're going to prioritize. What is practical? So if the owner doesn't have a big budget or insurance, we're not going to be able to do every diagnostic that's maybe listed. And then be pertinent. Maybe there's something else going on in that case that's going to have you do a diagnostic that's not on the list, but what's going on with that pet that we really want to help them with. And then I think the other takeaways is there's some new therapies out there. And so there's Stelfonta, there's Tanovia, there's some conditionally approved medications like Laverdia and Canalevia. So that's really exciting as well. And then I think my final 2 takeaways is to be proactive, and a lot of that with symptomatic treatment, like I mentioned, for pain, nausea, even while you're trying to make a diagnosis, just be proactive and not reactive. And finally, it's a team sport. And so it's great, if an owner and you have the availability to see a specialist, but if not, we have teleconsulting. There is a huge emphasis with that. And then also the GPs and our technicians, and really all of us can be involved to, make this as easy as possible. As cancer is a horrible thing to diagnose in our patients, but we can make it better.